Good morning, student. My name is Professor G.P. Paul, and I am Professor of the Human Anatomy. Today, we will learn about an introductory lecture on to the human anatomy. This lecture is meant for newly admitted students in medical colleges. First of all, I would like to congratulate you and your parents for your admission in medical college. In this short lecture, I will introduce you with the subject of the human anatomy. Naturally, since you have come to the medical college now, this must be a question in your mind that what are the subjects to be studied in the first year of medical college? In the first year of medical college, you will study three major subjects: anatomy, physiology, and biochemistry. When we just look on to the subject of anatomy, this is the subject which will just tell you how our body is constituted, what is the structure of our body, different systems of the body, for example respiratory, cardiovascular, nervous system, and many other systems. What are the structure of the muscles, nerves, vessels, and organs. So this subject will tell you about the structure of the human body. Now then, there is another subject in the first MBBS to be studied, and it is the physiology subject. And in physiology, you will learn how these various systems of the body they actually function. So anatomy is just only structure, while physiology will deal with the functions of the various systems of the body and as such the whole body. For example, you will learn how ultimately the heart is pumping the blood into the arterial system and how this blood is returning back. Okay, similarly in excretory system you will learn how kidney are functioning. Okay, then the third subject which you will learn is the biochemistry. And biochemistry is the subject which will tell you what are the various chemical process which are taking place within the cell, okay, within an organ. Now, for example, you must have learned in your classes, lower classes, that when glucose burns in presence of oxygen in individual cell of the body, it produces the energy and the carbon dioxide. In the similar way, there are many reactions which are taking place in body with the help of the hormones or enzymes. All these systems which ultimately functions with the body, these will be learned in the biochemistry. Thus, the first subject, anatomy, will deal only with the structure. The two subjects, physiology and biochemistry, they will deal how our body functions. Now, these three subjects which you will learn into the first MBBS, your first year of the MBBS course, they are anatomy, physiology, and biochemistry. And all these three subjects, they are also known as the basic medical sciences. Now, the question will be arising in your mind, why should we learn all these three subjects? Now, since this anatomy deals with the normal structure and physiology and biochemistry will deal with the functions of the human body, that is very important to learn. You should learn what is the structure of the human body and what are the functions of the various part of the human body. Without learning this normal structure and normal function of the human body, it will be not possible for you to understand what is the abnormality in the structure. Okay, so to know whether a structure of the body and organ, okay, or parts of the body is normal or not, you have to learn the anatomy. Similarly, for the to know whether the body is functioning properly or not. If the body is not functioning properly, this will lead to the disease. So to understand the function and disease, you will have to understand anatomy, physiology, and biochemistry. Now, then we now concentrate only on the subject of anatomy. Okay, so just for the time being, we will just deal with the human anatomy subject. Okay, now if we see the definition of human anatomy, then it is the study of the structure of human body. As I have just told you also, that anatomy deals with the structure of the human body, how it is made up, what are the constituent part of the body of the human being. But at the same time, in the medical science, human anatomy structures are only not sufficient. You will have to go one step further, which you have not studied in your lower class in anatomy of the animals. This is the relationship among the structure. Thus, there are two components here in medical anatomy. First is the study of the human body structure, and second component is that what is the relationship among these structure. Now, body structure is just not sufficient, as I said, to learn, because you have to learn what are the structure which lies in front of particular organ. Say for example, if you are learning the stomach, you will have to know that not only the structure of the stomach, its borders, surfaces, its blood supply, its nerve supply, but you will also have to study what are the other structures of the body which are lying superficial to the stomach. What are the other organs or structures which lies behind the stomach? Okay, what are the structures which are lying above? What are the structures which are lying below the stomach? Okay, that means how the stomach is surrounded by various other anatomical structures, organs, blood vessels, and the nerve. Then only the study of the stomach will be completed. This is true for any other organ of the body which you will learn. This will be true for any blood vessels or nerve or muscles which you will learn in the limb. Say for example, in upper limb or lower limb, you will have to learn which are the structure anterior to the artery, which are the structure which are lying posterior to the artery or on the side. So this is the interrelationship among the structure, and this is the reason why the anatomy subject become complicated, because you have to deal with the interrelationship of all the structure which you will learn. Now, when we define the human anatomy, we always say it is the body structure. What But the body structure, you will notice that is a broad term. Okay, you can learn the body structure in human anatomy just by seeing it the naked eye. Okay, just observing it. Okay, and you will learn the various gross things. Okay, about it, borders, surfaces, size, shape, all other things. Okay, but then the structure means you have to learn the structure of an body organ or any other blood vessels now, okay, with the help of the microscope. Okay, with the help, that means you will have to learn the structure which is not seen by the naked eye, and you will have to use the microscope. Okay, so you will go to the finer aspect of any structure, that is also anatomy. Okay, but then beside this, you will have to learn the structure of not only at the microscopic level, either light microscopic or electron microscopic level, which can enhance an image, or it can increase the image to 1.5 lakhs time. Okay, so that is also not sufficient. You will have to go one further step, where you have to learn the structure in some cases up to the molecular level. What is the molecular constituent of a particular structure? So it is not only the broad, gross structure of the, say for example, stomach or any other organ, but when you will learn the structure or the molecules of DNA, that is at the level of the molecule. So right from the structure of human body, which you can see by naked eye, or which you can not see even by the microscope. For example, the molecule structure you cannot see with the help of any molecule. It has to be seen indirectly. Okay, that is a different subject. So you have now learned that anatomy is nothing but the structure of the human body, starting from what you can learn with the naked eye right up to its molecular level. Okay, then it is also the interrelationship among the structure. Okay, coming to the next slide, these are the various subdiscipline of the human anatomy. For example, there are 4 branches of human anatomy which you are supposed to learn in the first year of medical science. Okay, and this is the first is the gross anatomy, and this gross anatomy will acquire your most of the time. Say for example, 60 to 65% of the time you will be dealing with the gross anatomy, and gross anatomy means the structure which you can see by the naked eye without the help of the microscope. So when you will learn this gross anatomy, it has 3 subdivisions. Okay, this is the cadaveric anatomy. The most important will be the cadaver. Cadaver means the dead body. So with the help of the dead body, you will have to dissect the dead body and learn the structures, their relationship, okay, which can be very well seen by the naked eye. But at the same time, you will also learn the living anatomy. The cadaveric anatomy is the anatomy learned by the dead body, but the living anatomy is the anatomy learned by the from a living person. How to study the anatomy in a living person? Because of the invention of various techniques, say for example X-ray, you can visualize the bone, the joints, and with the help of the spatial procedure you can visualize the lumen of the various organs. For example GIT, okay, with the help of the barium enema, or you can inject certain radio opaque dye and this will visualize the lumen of the ureter, bladder. Like that, there are the various procedures which become possible to learn with the help of the X-ray. Then further techniques which are used in the learning the living anatomy are the CAT scan, that is computerized axial tomography. Then came another method what is called as MRI, magnetic resonance imaging, sonography. Then the various kind of the endoscopes which are available will help us to directly learn the anatomy of a living person. Actually, we need to learn the anatomy of a living person only, but since we cannot dissect a living person, that's why we take the help of the dead body, which is the cadaveric anatomy. Then in this gross anatomy, which you can learn with the naked eye, will ultimately come the applied anatomy. And what is applied anatomy or clinical anatomy? This is the branch by which you will learn how to use your knowledge of the anatomy, whatsoever you have learned on your patient, which you will utilize in the afterwards the second year of the MBBS course, right? So this is the called as applied anatomy. So these are the 3 subdisciplines or the 3 branches which comes under the gross anatomy. The second subdiscipline is the histology or the microscopic anatomy. As I said that the structure which cannot be seen by the naked eye, they have to be learned by the microscope, either electron or the our light microscope. Okay, that branch is called as histology. So that will be another branch which you will learn with the help of the microscope. Okay, then the third branch is the developmental anatomy. That means this is the development of a fetus or embryo or fetus right from its fertilization, okay, right up to the adulthood is achieved. That is the developmental anatomy, while embryology is that period that is right from fertilization till the newborn is born. Okay, I mean say till the baby is born. That period of the whatsoever development takes place is the embryology. So that will be another important branch for you to learn. And lastly, we will also teach you the genetics, which will deal with the laws of inheritance, how the particular character is transmitted from one generation to the next generation, and what is the structure of the genes, and what are the genetic disease which can be I mean to say we can control, or which cannot be controlled, cannot be treated, all those genetic disease which we will learn in this branch. Okay, so these are the various sub-disciplines of human anatomy, and we will just take further. First, the gross anatomy. I will tell you little more in detail about the gross anatomy. What is gross anatomy? As I have already defined it, gross anatomy is defined as the study of the structure that can be seen with the naked eye. That I have already told you, without the help of the microscope. And we have seen the three subdivision. Cadaveric anatomy was one, and this will be learned with the help of dissection of the dead body. Okay, and this is learned, okay, with the help of the combination of the lectures and dissection. That means your teachers will first take the lectures in lecture theatre, and then you will go into the dissection hall to dissect the same thing what was taught in the lecture theatres. Now, the various structure of body and their interrelationship can very easily be studied by the dissection method. That was our definition of the anatomy, which you can see by the naked eye. When we go further in this, from where do we get the dead bodies for dissection? When I am teaching you that you will have to go for the dissection and do the dissection on the dead bodies, then the question must be coming in your mind, from where do we get the dead bodies for the dissection? Dead bodies are obtained from two different sources, either by donation or unclaimed dead bodies. When there is nobody to claim a dead person, usually the beggars who die by the side of the road, police bring this dead body to the medical college for this dissection purpose. Okay, but nowadays most of the dead bodies which we receive in the anatomy for the dissections, they are donated bodies, and because of that, now more and more people have started donating their dead bodies, and then the scarcity of dead bodies is little has eased out. Okay, now this dead body, when they are received, they are preserved very well, and all this technique, how body is received, from where it comes, okay, how to preserve the body and how to keep it in tanks for years together, that will be taught to you when you will go on the first day in the dissection hall. Okay, your teachers will teach you. If your teachers are not teaching you, please ask them how the dead bodies are preserved and how they are obtained. Now this preservative usually which we use is mostly the formaldehyde solution. Okay, and then you will learn about how to preserve the dead bodies by making the injections. Okay, now the dead body is studied in the dissection hall can be achieved by the two different method, or as such even the theoretical, if you are learning the gross anatomy, that has two different method of learning. The first method is systemic anatomy. That means where your teacher can teach you system after system. That means first cardiovascular, circulatory system, and then they can teach you any other musculoskeletal system. They will teach you the nervous system, reproductive system, respiratory. So system after system you can learn the anatomy, as you were doing till now in your lower classes. When you were learning the anatomy of the animals, you were learning by systemic method. Okay, system after system. But then this method is not practiced in the medical schools or medical colleges. Why? Because if you will go by this method, then you will have to dissect so many bodies, because once you will dissect start dissecting one system, that body will get spoiled. Okay, you cannot dissect the other system on the same body. That's why there is another method of study of human anatomy which is practiced in most of the medical colleges. It is called as regional anatomy. That means you study the human body structure from region to region. For example, when you will go to the dissection hall, okay, you may probably start your dissection with either upper limb or with the lower limb. And when you are dissecting the upper limb and lower limb, you will see many systems inside at a time. For example, when blood vessels, artery and veins you will see in the upper limb, this constitute the part of the cardiovascular system. Then you will see various nerves, you will see muscles, bones, joint of the upper limb in that particular region, and that is the regional anatomy. That way we need only one body to learn the anatomy of complete human body, a human through one single body. Okay, that's why we say body. Now, the systemic anatomy approach, though may be easy for one system, but it is quite confusing in medical science. Though the Gray's Anatomy and many other books in human anatomy, they describe systemic anatomy, but you have to use, okay, the regional anatomy, okay, in the medical science, which is more beneficial. Okay, let us see further aspect of the grass. We are still on the grass anatomy, where you can see by the naked eyes. Okay, so one part we have completed, A, that was the cadaveric anatomy, the anatomy learned by the dead body. Okay, now we come to the living anatomy. As I have already told you that in living anatomy you learn the anatomy of from a living person, and because of the techniques which are available, which can look inside the human body. Okay, and these are called as medical imaging. And what does mean medical imaging? Medical imaging means that you can image the structure of the human body, okay, without harming. And these are the technique, as I have already described: x-rays, CT scan, MRI, sonography and endoscopies. Most of the departments in India, okay, they teach you the x-rays after the completion of that region. Say for example, head and neck region, so they will show you the x-rays with the various special techniques also of that particular region. So region after region you will run the x-ray, you will learn the CT scans of that particular region, MRI. Okay, and some of the departments in India have started teaching also the medical imaging through sonography. Okay, now, when we come to the third aspect of the gross anatomy, it is clinical anatomy or applied anatomy, and this is the knowledge of anatomy when it is used in your clinical practice on your patient. That means when you will use the knowledge of anatomy to treat a patient, that is called as the clinical or applied anatomy. Both living and clinical anatomy will be taught to you along with the cadaveric anatomy from part to part. Okay, so whenever there will be a lecture on particular subject which has something to tell about the disease. For example, there will be, when they will teach you the heart, at the same time they will teach you various disease associated with the heart very superficially. For example, they may tell you the coronary arteries, the branches of coronary arteries, and at the same time they will also teach you what happens when these coronary arteries are blocked. Okay, that means how the heart attack in a layman's term ultimately is there. Okay, that thing will be taken. They may also tell you while teaching you the heart what happens when the heart valves are defective. Okay, defective. So this is the applied anatomy. Okay, that is an applied. Let's come to the next slide, and this is, now we have completed the portion of the gross anatomy. That means anatomy which you can learn with the help of, just by seeing the naked eye. Okay. Now, which is the first book to be studied in anatomy? Okay, that is the important question. Okay, which is, and this is called as general anatomy. So, for the first 10 to 15 days, when you will start going to the anatomy department, you will be asked to learn the general anatomy. Okay, so what is general anatomy? General anatomy is an introductory subject which is taught to newly admitted student in every institution before they start learning the actual anatomy subject or start dissection. Okay, start dissection. And these introductory classes on general anatomy will be taught to you. Some institutions take 8 to 10 lectures, some institutions they take 10 to 13 14 lectures even can be taken on to the general anatomy. Now, why this general anatomy is to be learned before you go to the actual study of the human body, okay, or onto the gross anatomy, before you start your dissection. It provides the basic concept of the human gross anatomy, okay. So human gross anatomy or cadaveric anatomy concept can only be learned very well if you learn the general anatomy first, okay, because it is providing the basic concept of the gross anatomy. Without understanding the general aspect of the gross anatomy, which will be taught in these 10 to 12 lectures in the beginning, this student then will find it, otherwise student will, if you will not learn it properly, then you will find it difficult to understand the subject of anatomy. Thus remember that the general anatomy, the initial 10 to 12 lectures are very very important. You will have to learn by heart whatsoever has been taken into the lecture of this general anatomy, and this will be your first book in the general anatomy. Right. So this consists of the first subdiscipline of the human anatomy, right? In the anatomy department, that is the major part. Then there will be a second, I mean to say, branch of the anatomy is the microscopic anatomy or histology. Most of the thing I have covered about the microscopy. That means a structure which you cannot see by naked eye, you have to see it under the microscope. May it be a light microscope or electron microscope. So what you will learn in histology, you will learn the structure of cells, different kind of cells. Then you will learn the structure of tissue, okay, and organs with the help of microscope. So that means first you will have to identify cells, then tissues. There are various basic tissues, and once you have learned about the tissues, then they will teach you about the various system where organs are located. Then you will have to understand about the microscopic structure of a particular organ. Now, histology is necessary to understand the function, that means for physiology. If you will not understand the histology, where there you are going up to the level of the cellular details, what are the functions of cell, what they secrete the cells, then you will not be able to learn the physiology. So it is very important to learn the histology before you learn the physiology of the tissue or that of the organ. Then histology is also necessary to diagnose the disease which is can be seen under the microscope. Some of, say suppose an organ is defective or there is something wrong in the organ, you will order for its biopsy, means you will take out a section from that organ, a small piece, cut it into the slide, and then will see under the microscope, and then you can diagnose to which disease that organ is suffering. That means a person is suffering his, say for example, it is in the stomach itself, okay, then you can see that the stomach is having this histopathological problem. That for that region microscope anatomy is very important, okay. Now, as I said that you can study with the light microscope or you can also study with the electron. Most of the study in anatomy department is through the light microscope. But at the same time, we also show you the pictures of the structure of an organ which is taken with the help of the electron microscope. From this year, okay, the Medical Council of India, according to the new curriculum, the concept-based medical education, they have included the electron microscopy of various systems of the body. Now, histology is taught. As I said, that gross anatomy, cadaveric anatomy will be taught with the help of lectures and dissection. In the similar way, the histology will be taught to you by 1 hour of lecture every week and 2 hours of the practical class till the histology is not over. Okay. Then we come to developmental anatomy. Okay, our third branch will be the embryology. It will deals with the development of an individual, I told you, from conception to adult form, that is up to the you become adult. Okay, and that is called as developmental anatomy, and this is expanding right from fertilization to the adulthood is achieved because the anatomy keeps on changing in childhood. Okay, and until and unless you become adult, your anatomy is changing. That is the reason why the developmental anatomy has to be studied right from the fertilization till the adulthood. But in medical science, okay, in anatomy itself, we will not go further except few aspects of the developmental anatomy. We will teach you only the embryology, and embryology is right from conception till birth of the baby. Okay, so whatsoever systems are developing, how the trilaminar germ disc is formed, how ultimately each germ disc gives rise to the various system of the body, these all will be taught to you in embryology. Now the big question comes, why a medical student should learn the embryology? Okay, because what it is has to do with the patients. Now embryology is very important because of two reasons. Number one, you must have seen many peoples which may show the defect in the formation of the body. Say for example, you must have seen on the face people with the cleft lip, there is cutting in the lip is there. Okay, that is called as the cleft lip. You must have seen the patients which are having the hard palate, that means above the tongue there is a structure called as hard palate, it is also defective. Okay, then you must have seen the persons with extra finger or lace finger or abnormal hand, short hand, or absence of one particular organ, right? So these are right from the birth, that means they are called as congenital anomalies, and these structures are due to something has gone wrong during the formation of that organ. That means within the womb of the mother, when this organ was forming, say our face was forming, then this defect must have occurred. That is the cleft lip or cleft palate must have occurred. And then at the same time, you must have to learn that why this defect has occurred. That is the utility of the embryology. So when a person or a patient is brought to you which is having congenital anomalies, you should be able to diagnose it as, diagnose means you should be able to find out that that particular defect is embryological in origin, okay, or some other cause is there. And then once it is decided at embryological of origin, then you should also tell to the parents, okay, of the child that this must have occurred because of this region, okay, because of this region, and if that defect, okay, can be treated or not, okay, or not. Okay, some of the surgical procedure now can treat the morphological or structural defect, but those which are genetic defect cannot be treated. Okay, that we will learn in genetics. Okay, now second aspect of learning of an embryology is, because when you learn the embryology, then only you understand completely the gross anatomy, which you will learn in dissection hall. Okay, unless and until you will not learn the embryology, you cannot learn many of the structure of the human body, because you are learning it right from the beginning, how these structures are formed which are present in my cadaver, okay, in my dead body to whom I am dissecting. For this, I will give you two example. Okay, suppose there are two engineers which are car engineers. One has knowledge to assemble a car part by part, okay, and another engineer, he can only repair the car if it is some part of it is defective, some mechanism is defective. Now tell me, which engineer will have better knowledge of the car? The first one who has assembled the car and ultimately have constructed the whole car right from the beginning, or the one who has the knowledge to repair it? Definitely it will be the first engineer who has the knowledge of construction of it. Okay, and this is exactly applies to the human anatomy. Okay, when you know how the body parts were developed, then you will learn the anatomy also in a better way. Okay, you can correlate it in a better way. So this was the third branch which you will learn, and this is the last branch, the genetics. And you must have already learned a lot about the genetics in lower classes, and here we will use those aspects of genetics which are associated with the disease. The medical genetics only we will learn. We will not learn many other things which you have learned. We will learn about the chromosomes. We will learn about ultimately how the defects occur. Okay, chromosomal anomalies and the defect due to the mutations in the gene we will learn, and what are the diseases which are associated with the human genetics. Okay, and whether you can treat that disease or not. Okay, that will be taught to you in the genetics with the help of almost 8 to 10 lectures. And embryology, there will be one lecture per week. Okay, and mostly in the practical you will be shown the models of those embryological specimens, right? So ultimately we come to the summary of what we learned today. Okay, we learned that the human anatomy has 4 subdisciplines. That is gross anatomy, where you learn the anatomy by your eyes. Microscopic anatomy, where you will learn the structure of human body with the help of the microscope. And embryology, where you learn how the various systems of body are formed. Okay, and genetics. Okay, the molecular genetics and chromosomal. Chromosome can be seen by light microscope, but genes cannot be seen. Okay, genes cannot be seen with any method. You have to just depend on indirect method. So this completes the first lecture on to the, which was just an introductory lecture to the subject of human anatomy. Now in the next 10 to 12 lectures, I will try to cover all the aspects of general anatomy, so you are prepared for the study of the human anatomy. Thank you very much.